Hi everyone, welcome to POC Nurse. My name is Gozi. So the other day I was on the internet and someone was asking which is more stressful, hospital nursing or home health nursing. Now the answer you get depends on who you are asking and their experience working in the hospital versus working in home health care. And that's if they've done both and maybe for how long, what department in the hospital. I think that will matter because if you work in med-surg, you might have 8, 9 patients. If you work in mother baby, same thing. If you work in labor and delivery, your max is 2 patients. Critical care, 2 patients. Maybe 3. But during COVID, I had up to 4 patients in the ICU. If you work in the ER I worked at, our max was supposed to be 5, but sometimes we'll get 6. But you have to remember those patients are kind of in and out. So I'm going to give my thought on this question, which one is more stressful, home health care or hospital nursing, based on my experience working overall in the hospital, different departments, and in home health care. Now, the answer to this question also depends on the kind of home health agency you worked at. The one I worked at, the nurse was everything. You were the case manager, you did wound care, you placed the Foley, you did the visits, you did the admissions, resumption of care, recertification, you did everything. And I've only done home health agency with this one place. Someone I spoke with told me that at an agency she worked at, they had a nurse for admissions, they had a nurse for wounds, they had a nurse for just the visits. So they didn't have, each one nurse doing a lot of things or wearing many hats. But one thing I will say is that I love being a nurse. I love what I do. And where I do it doesn't really matter. What matters is the kind of environment I'm working in. Is it a supportive environment? Is it a hostile workplace? Is it a toxic workplace? That kind of thing. Is it safe? That's usually what concerns me. But baseline, being a nurse, I'm grateful for it and I love it. So far, I've been blessed with working in good places and good people. Okay, so now the first thing I would consider if you're asking me about the stress factor in home health and hospital nursing is the driving, the travel time. So I work in the hospital, I hop in my car, I drive to work, I park it, I go inside, and I'm there all day. It's nice and warm sometimes. I get to eat, I get to go to the bathroom, I get to take care of my patients. At the end of my shift, I hop in my car, drive home, and I'm done. In home health nursing, first off, I have to make sure my GPS is on point. I have to make sure I have a good phone stand to put my phone on so I can see where I'm driving. I gotta have my glasses. I just started wearing glasses now. I have to wear it all the time. When I did home health care, I have 3 pairs because I'm kind of forgetful. I have 3 pairs of glasses. I leave one in my bag, one in my car, one on my face. Sometimes I might take off the one on my face, and in my rush to get to my car and start work, I leave it at home. Well, I have one in my bag, I have one in my car. The one in my bag, sometimes I might put it in my pocket, forget it's in my pocket, I have the one in my car. So I always have my glasses with me. I also need it for work now to look at the computer, because when I stare at the screen for a long time, my sight gets blurry. But mostly when I look at a small screen like a tablet. So in home care, I gotta have my glasses, gotta have my phone stand, and my GPS, because I drive from place to place. Another thing to consider with the driving is the wear and tear on your car. That's stressful when I think about it. This car might break down on me. I'm really pushing this car too hard. How long will I keep this car? The wear and tear on the car. The amount of miles you're driving that you're putting on the car. For example, if you're thinking about selling the car later to get a better car, if you're doing home health care, you're going to put a lot of miles on the car. Might be stressful for you, might be not, depending on how you feel about, the vehicle you're driving in. Another thing with driving is weather. So in home healthcare, you might be driving through snow. If they don't call like an emergency, you're gonna go to work. If there's no state of emergency and everyone is working, you will be working. You'll be driving through the snow from patient to patient. If it's raining, you're gonna be driving through the rain from patient to patient. If it's a beautiful day out, nice and warm, beautiful summer day, you're also gonna be out there driving from patient to patient. But in the hospital, you have your 2 patients, 3 patients, depending on where you're working. You have your patients, you know where they are. You go from patient to patient. You see your patients, they're right there. You're not walking through snow or anything. So that's one thing that you may or may not find stressful is the travel from patient to patient, or the travel from your home to your job. It's one stressful factor of home health nursing or hospital nursing. Maybe a stressor for you, or it may not be. The next thing is supplies. Oh my goodness, supplies. So when I first started home care, I got a box of supplies from the job. I got a bag with supplies in it. But sometimes I would go to the patient's house and I don't have the necessary supplies to take care of the patient. The wound care or something. Oh my God, it used to be so frustrating. And I'll be like, if I was in the hospital, I'll just go to the supply room and get everything I need. So that's another one, is supplies. In the hospital, you have all your supplies. If you don't have it, you can go to another unit to see if they have. You can call the storeroom to bring it up. Sometimes it used to feel like such a luxury when I started home health care, and I would go in the supply room, I'd look at everything I need was right there. I wish I could carry that whole room in my car when I was doing home health nursing. So not having the supplies for my home health patient was truly stressful. One time I had to go do wound care on this patient that we were a day late doing her wound care, so it had to be done that day, and my shift had actually ended. I was kind of like on unpaid overtime. I didn't have what I needed. I called the office. I told them, if I don't have it in my car, I'm going to come to the office to get it. But that patient's house was literally 5 minutes from me, and I wasn't going to drive to the office to get anything. So I went to the pharmacy and bought what I needed and went back to the patient's house and did her wound care. And that wasn't the first time that had happened to me. I'd had other instances where I didn't have what I needed. I kind of improvised as best as I could, ordered the supplies for the patient. And that's another thing. You might order the supplies against your next visit, and the supplies still won't come on time. It still won't come on time. So after the first couple of incidences, I started, anytime I go to the office, I just grab as many things as possible that I think I might need and just put in my car. And then your car winds up looking like a medical supply car. But, it is what it is. So that's another stressor that you could have. One day I walked into a patient's house to go change a Foley. And I was like, okay, where are the supplies? And they're like, we don't have any supplies. I'm like, what do you mean you don't have any supplies? The office said you have everything. Everything was ordered to your house. They said they didn't have anything. I'm like, in my mind, how am I going to change this Foley with no Foley? And then eventually the family was like, well, we bought our own supplies. We have some supplies we can give you. So I was so thankful. They had the Foley, they had everything. So I changed out the Foley and, I went back to the office and was like, this patient, actually I called the office. This patient said they don't have supplies, please. We need supplies. And they were like, we already ordered months ahead supplies for this patient. What's going on with the supplies? I was like, I don't know, but I'm going to order more stuff. So I ordered more stuff for the patient, and I also made sure I had Foleys in my car after that day. So supplies can be a source of stressor when you talk about home health nursing versus hospital nursing. Another possible stressor could be resources, right? When you're in the hospital, if anything goes wrong with your patient, you can call a rapid response. if you notice something off about your patient, you can grab the resident right there or call the hospitalist. You can call someone to come and evaluate the patient. And if the patient needs to be, like sent to a higher level of care, right there, if you're in med-surg, this patient needs to go to PCU, the patient goes. Patient needs to go to tele, patient goes. Patient needs to go to the ICU, the patient goes. So, in that way, hospital work is less stressful, if you ask me. Now, fast forward to home care. If you're working on a patient that's in a crisis and it's just you, and you have to know that this patient is in a crisis. So like if you're a new grad, you might not know what to look for. So having some experience or a very good orientation, because I feel like new grads should be able to work anywhere. If you have a good orientation, a long enough orientation, you'll know what to look out for. So if you're working on a patient, the patient is in crisis, the patient needs something, you are it. You are everything. But you need to remember, you still have your resources. You can call 911 if it's something that is emergent, like the patient needs that care right now. You can call the office and speak to your manager for direction. And you can also call the patient's doctor to ask for direction. The only problem is that all of these resources are remote. So you're still going to be by yourself for the most part. Or if the ambulance is coming, you're going to be by yourself for a little bit until the ambulance gets there. And it's a real stressor. If something is going on with the patient actively and you're waiting for the ambulance, that wait will seem like forever. It can get stressful that way. I mean, if you're in the hospital and your patient codes, it's still stressful, but everybody is there. You're not by yourself. You have someone running the code, someone doing compression, someone ventilating the patient, hopefully someone keeping time. Everyone might have to double up on the responsibilities depending on how well staffed the hospital is, but you're still not alone. In home health care, you're by yourself. So if you're a new grad, make sure you get a very good orientation. And if you're ever in doubt about anything, call your manager. Make sure you document that call as well. Call your manager if they try to send you to do something you don't know how to do, you haven't experienced before. Speak up. Say, I haven't done a wound vac before. Can I shadow someone first? Can I go with someone to see what it's like? I haven't changed the Foley by myself before. Can I go with someone so they can watch me do it, make sure I can do it right, and I'm comfortable with it? Always speak up for yourself, because once you start working, once you get off orientation and you're on your own, if anything goes wrong under your care, your nursing license could be in jeopardy. So always make sure you reach out for all of your resources. If you don't know something, talk to someone who's higher up than you that can direct you, and document that talk or that call. Document it. You let this person know that you're not comfortable with this. This is the direction that they gave you, right? Or this is what happened. Always document. That's how you cover yourself and protect your license. Okay. So that autonomy in home health care, it can be a source of stress. But it can also be good because you don't have anyone breathing down your neck. You don't have anyone saying, have you done this? Have you done that? Make sure you do this. Make sure you do that. So that way it can be nice, but it could be stressful. Another thing is the environment where you are. So if you're in the hospital, you can fix your patient's room with the supplies that you need. Put them where you need them. Put your IV pole where you want. Arrange everything so that your workflow is nice for you. You go in, you know where this is, where you put your TUMI syringe, so you can, give your meds through a PEG tube, OG tube, NG tube, whatever. You have your sterile water there, you have a cup there, you have everything you need, right? You know where your supplies are, you know where to go get your supplies, your break room, your bathroom, where everything is, you can arrange it to suit yourself. But when you're going to a patient's home, you're walking with your bag and whatever else you're carrying and your shoes. Sometimes I walk into a patient's home, the first thing they ask me is, could you please take off your shoes? Sure, no problem. I take off my shoes. I always have my socks on. because some patients they don't wear shoes in their home, or they don't wear outside shoes in their home. They have shoes for inside and shoes for outside. Now you walk in, you're carrying your bag. I always ask, where can I put my bag? And then I put my bag wherever they tell me. If it's not going to be comfortable, like I can't reach whatever I need to take care of the patient, I'll say, well, I need to put it down close to you so I can do your vital signs and all of that. Is there anywhere else I can put my bag? And, they make arrangements for me. They bring a table. They move somewhere closer to a table. So you have to use the environment the way they ask you to use it, not how you would want to use it. So that's another thing. To me, it's not a stressor. Some people might not like to take off their shoes. Some people might want to do things their way, even though it's the patient's environment, because it makes sense logically. Like if they tell you to put your bag on the table over there and they're sitting over here, it doesn't make sense. But I still try to work with them to see how we can, work together and get their care done, and then I would leave. It wasn't such a stressor for me, but it might be a stressor for other people, but I was okay with that. But it's nice to be able to put all of your stuff where you want and use them as you need. It makes life easier. Another thing about hospital nursing or home health nursing is the patient load. How many patients do you have for the day? So if you work in something like L&D, you will have 2 patients at any one time. For the most part, if your patient delivers and you transfer the patient, you may get another patient. So you might have 2 patients at any one time, and you might have 4 patients for the day. If it's a busy day and your patients come in like drive-by, deliver, boom, and you send them off like that, in and out, you might have more. But for the most part, you have 2 at a time. If you work in the ICU, 2, maybe 3 at a time. The ER, 5 or 6 in the ER that I worked at. If you work when I worked in PACU, I believe it was 2 at a time, 2 or 3 at a time. So when I work home care, I was required to see it depends on the kind of patient. Sometimes you see 2 patients a day. If it's an admission, you might do 2 admissions a day, and it's a lot of OASIS paperwork. But if you kind of go through it while you're with your patient and they're very responsive, like you ask a question, they give you the answer, boom, you could get through your OASIS pretty nicely. But, if it's a patient that's kind of rambling, they're not giving you a straight answer, they don't understand the question, you have to use an interpreter, you have to get a family member on the phone to answer, it might take longer. So if you have an admission, 2 admissions for the day, you get only those 2 patients, but the admissions take time. If you're seeing regular patients for the day, including patients that you have to do wound care on, Foley changes, take care of an ostomy, take care of a drain, you see about 6 to 7 patients. And if you're seeing those 6 to 7 patients in the same area, it's okay. Your workflow will be nice. Now, if you're seeing those 6 to 7 patients in different cities, it might get stressful. It might get stressful because you find yourself kind of trying to get to the patient. So you're fighting traffic, you're using your GPS, you're looking for parking. You're doing all of that just to get to the patient. That's stressful. That is stressful, and you're doing it from city to city. If you do it long enough, you might get to know all the cities and, know where to park. Even if you know where to park, you still might not find parking. But that can become stressful because, one, the drive itself is stressful. You're using your GPS because you really don't know all of these areas. You're trying not to get lost. You get there, you look for parking. And you're looking at the time. You're already thinking about, I have to go see my next patient. You're still trying to get to the one you're going to. You finish seeing that one, you get in the car again, fighting traffic to go to the next patient. And For me, I can do all of that within one city, no problem, especially if I know that city, most especially if that city is where I live, because I know my home is right around the corner. No matter what, I'll see all these patients and I'll get home in good time. But if you're driving from one city to the next, and you might think, oh, this city is just the next city over. But each city could be big. You might be driving from one end of this city to the very end of the next city. It takes time. And when you factor in parking, traffic, and all of that, it's going to take you time to get from patient to patient. Now, the travel time is stressful. And then you want to think about now how many patients you have to drive like that to go see. That's another stressor. Okay, I have to do all this driving. I have to see all these patients. And you still even don't know what you're going to encounter when you get there. It might be a patient that that's usually stable. You might get there and today the patient is unstable. You're trying to reach the doctor's office. You're calling the ambulance. You're thinking, I still have to go see the next patient. So in that case, it can get really stressful. It can get really stressful if you're in the hospital and you have 8 patients. They're right there. You go see all your patients. You don't have to wait through any kind of traffic, look for parking or anything. So in that sense, for me, home care could be stressful. Now, if the patients are all in one city, even if you have to drive from your city to their city and you see all your patients in that city, and then you can drive from that city back to where you live, I think it would be less stressful than if you're driving from one city to the next, and stressing about seeing all your patients because you have to see all your patients. If you're unable to see 1 or 2 patients, you also have to communicate it to the office early enough so they can see if they can send other nurses to see the patients or if the patient's visits can be postponed. So that way it is stressful. It is stressful if you ask me. The patient load and where the patients are can be stressful. So in this case, I would say for me, the hospital nursing would be easier, especially if you're working in a place where you have like minimal amount of patients, like PACU, endoscopy, places like that. Another thing is documenting. Documenting can be a stressor in home care, depending on what you're documenting. If you're doing an admission, Oasis admission, it's a lot of paperwork. If you're doing a regular visit, the paperwork isn't that much. Even when you have like extra things you have to do, like change a Foley, do wound care, you have to measure the wound and all of that, but it's still okay. The only place where you have a lot of documentation, if you're doing an Oasis admission, to me, an Oasis discharge, you're doing like a resumption of care, or you're doing like a recertification, you have a lot of paperwork. Mostly the admission is a lot of paperwork. Your regular visits are okay. The documentation is not that much. The only place where documentation becomes a stressor is if you don't have enough time to input your information in your tablet or laptop, whatever device you're using, and you have to bring it home with you. When you bring it home with you, you're still working. And if you're a salaried worker, you will not be paid any overtime for the extra hours that you are working. That could be a stressor for someone. So in the hospital, on the other hand, you know what your documentation, even an admission to me, in the hospital is not bad. You get through. It's a lot of paperwork too, but it's nothing like the Oasis paperwork. Nothing at all. You do your admission, you do all of your paperwork, and you move on with your shift. The Oasis admission is different. It is a lot of paperwork and it can be stressful. But once you get the hang of it and you get your own method for getting it all done, it's still stressful, but not that stressful. Okay. Another thing with home health nursing versus hospital nursing is kind of outcomes. So, like, I have a patient for my whole 12 shifts. I give Tylenol, while I'm there. I might be able to see the fever go down. If I do something for the patient, I'm able to see the outcome. I put in a Foley. I see urine is coming out there, is draining nicely throughout the shift. I know it's working. In home care, you might go see a patient, do an intervention or something, and you go home and you kind of worry. I hope this is working. I hope everything is okay. I change a Foley. I see urine. I see I have return of urine, and I hang out a little bit. The urine is not really draining as much. Maybe there's no urine in their bladder, but for some reason, when I go home, I worry. I'm like, I hope it's draining. I hope there's no problem. And then I remind myself, well, if there's a problem, they can call the office. We're open 24/7. But I still stress a little bit. I have patients on antibiotics. I teach them how to do it. And I'm thinking, I hope they're able to give themselves the antibiotic. But, I told them any questions to call the office. And I remind myself, if there's anything, they'll call the office. They should be okay. And maybe the office will call me or something. So I would stress like that. I'll do a wound change. And maybe the wound looked a little off. I'm like, I don't know about that wound. I hope they'll be okay. I changed the dressing. I did call the doctor. The doctor said it was okay. Well, the doctor said it was okay. It should be okay. And I remind myself, well, I told them if anything, call the office. I did teach them signs and symptoms of infection. So I would worry like here and there like that. So it was kind of stressful, but for the most part, everything was okay. I did have a patient whose wound vac I changed. And then the next day, the wound vac had issues. The vacuum itself, they had to ship him out another vacuum, which the next time I went, I put the new vacuum on. So things like that. In the hospital, you do your interventions. You're able to see the results, hopefully while you're there. And even if you don't, there's another nurse coming behind you that you can endorse it to, that'll pick it up from there. The home health patients, you might only see them once a week. So once you see them that Monday, the next time they're going to see a nurse might be the following Monday through Friday. It might not be the following Monday. It might be the following Wednesday, Thursday or Friday. You can always make a phone call, a phone visit to see how the patient is doing. But to me, that was a stressor. Probably still will be a stressor when I go back to home health nursing. But yeah. And the last thing with home health nursing that could be stressful, I spoke on it a little bit before, is experience. How much experience do you have as a nurse caring for patients that are sick? So if you go from something like L&D to home health nursing, you're going to need a good orientation because it's very different. You're going to be taking care of males and females, all different age groups. You can take care of young people, middle-aged people, and old people. And the experience matters, but it doesn't matter in a sense. So if you don't have experience in caring for sick patients as a nurse, you can still take a home health care job, but you need a good orientation so that when you're on your own, you'll be all right and it won't be too stressful for you. But it can be stressful if you don't have enough experience and you're going out there on your own. So in this case, just like I said before, if you don't know something, speak up so you can get the training for it. And if you have a good amount of experience caring for sick patients, you're going to be okay when you go out there to see the patients in their home, because it's basically, and I've seen patients in the home that I saw in the hospital. So I kind of know them already. I saw them when they were sicker, and I can see in their home that they're better or getting better. So I was comfortable with home care. The only thing that it took me getting used to was being totally alone when I needed to talk to someone about a patient. So I would call the doctor, call the office. If I have one of the home health nurses that I work with that knows the patient very well, I might call them. So I always made sure to use my resources. So the amount of experience you have or don't have might be a stressor for you for some time. Once you get your experience down, that stress level should go down, should be lower. So yeah, these are the things that I think could be stressors for someone thinking of going into home health care versus working in the hospital. But to me, I feel like I like all of nursing. But I haven't worked med surg though. I've worked tele where I had up to, was it five patients? Five patients or six patients? I think six patients. That's the most amount of patients I've ever had. I worked postpartum sometimes, and I think I would get 6, 7 patients, maybe 8. But it wasn't bad. It was postpartum moms, and for the most part, they were healthy. And when they got sick, they got transferred, somewhere else, depending on what the problem was. Maybe they go to ICU, or they go somewhere where they'd get the level of care that they needed. So yeah, some of these things could be a stressor for someone thinking of going into home health care versus work in the hospital, or it could not. But, it's something for you to think about if you're considering home health care versus hospital nursing. I hope someone out there finds this video valuable. And like, share, and subscribe. And I'll see you in my next video. Bye-bye.